One of the things that I would like to sort of blend in is my role as a mother, my role as an advocate, my role as a friend, my role as an aunt, my role as a leader, all of those things that many of you all are. And clearly, as a mother of a 15-year-old son and a 17-year-old daughter, I have to balance a lot. I was very fortunate, as many of you all are, to be a product of a strong mother. My mother rose to be the highest-ranking woman in the paper factory in Macon, Georgia. And I watched this woman for 25 years work the swing shifts, 7 to 3, 3 to 11, 11 to 7. She would come home filthy, smelling of pulp, tired to the bone, but she was still ever present to raise 4 girls. She taught us to dream and possibilities and not limitation. And even though we didn't have a lot of money, we were clearly the most popular house on the block, 5 women in the household. Got a little moody sometimes, but lots of love and support. But I grew up in the Deep South. Coming of age in the post-civil rights era, we faced a lot of obstacles as women, pursuing dreams that many others, particularly in the Deep South, had abandoned, and some that we didn't even dare to imagine. My journey has been one that I like to share because I think it makes a difference if you get to touch the lives of just one individual. Advancement for women over the years has brought new rewards, but it's also brought us pitfalls. We have changed this conversation when we figured out that we could go from housewife to mother to the boardroom. The battle has been fought. Some people think we won it. I think that's a question. Because sometimes I think we give up too much in order to get to that boardroom. One of the things that I think we give up is the responsibility sometimes of being healthy. And so one of the first things I would like to challenge us with is to be engaged, to fully commit ourselves to leading healthier lives. Now, I also want to make sure that I hope that I make the connection here that I believe a healthy lifestyle is clearly connected to a successful career. I believe that better health makes stronger leaders. Part of it begins separating facts from myths. So let's work on that a little bit. So by applause, please clap if you think this statement is true. When it comes to health care, women of color generally fare worse than white women across a broad range of measures in almost every state in the union. So if you think that's true, clap your hands. Second, even so, though, each racial and ethnic group of women face their own particular set of wellness and healthcare challenges. If you think that's correct, applause. And then finally, when you look at health status of women, you must also consider access, utilization, and social determinants like the availability of transportation. If you think that's true, clap your hand. Now, if you applauded, then you've already begun this process of separating myth versus fact, particularly for women of color. In 2009, the Kaiser Foundation sponsored a state-by-state study on the disparities in women's health. They discovered that women of color fare consistently less well than white women across a broad range of measures. And in some states, those disparities were even more striking, particularly for diseases like breast cancer, hypertension, and diabetes. The disparities that we face around this country, though, are not just because of access, they also are because of quality care. Now, I know that all of us believe that the Affordable Health Care Act is going to positively impact access. However, we all know that if we gave everybody an insurance card today, it would not necessarily eliminate the disparity. So let me give you an example. Breast cancer. Many people believe that the disparity that we see with breast cancer mortality is primarily because of access and delayed diagnosis. I would like for you to consider this. Prior to Medicare coverage of mammograms, meaning that a woman can have a mammogram if she is 65 years of age, the black-white mortality rate for breast cancer was lower for black women as compared to white women, which you would expect because white women have a higher rate of being diagnosed with breast cancer. But after Medicare began to cover mammograms, we saw a reversal of the mortality rate, with more black women dying from the disease than white women, and that trend continues. So access did not change the outcome. In order to figure out why this disparity exists, we must do additional things than just provide people care. We must do research. It is really important to understand what are the environmental influences. Why is it that black women have a later diagnosis? Is it because they have more dense breasts? Those are the types of things that are really, really critical if we're going to make a difference in the disparity of any disease.